Hi, it's the nursing professor back again to continue talking about the interview with the patient. Last time we talked about the interview, but today we're going to talk about obtaining a H&P or a history and physical of a particular patient. So this is going to be all the things that are not associated with hands-on. So this is still talking to your patient to gather information. All right, so a couple of vocabulary words to get out of the way first. There are typically three types of assessment. One is a comprehensive. That's when you do a head to toe. You're asking that person and you're actually examining that person from head to toe. You also have a focus assessment where you're actually focusing only on the complaint. So the person says their stomach hurt, you're asking questions all about the stomach. If they say that they have difficulty breathing, it's all about the respiratory system. So focus assessment is more based on a particular system that a person is complaining about. Follow-ups are related to a person that has already been seen, they've already given their complaint, and they have been prescribed something, be it a treatment, exercise program, medication, and they're back for the provider to evaluate the effectiveness of that, because we always got to evaluate. There's no sense in people taking medication that doesn't work. And so that is what a follow-up assessment is as a part of the interview. All right, so there's two types of sources. One is primary, meaning that all the information that you get is directly from the patient. The second one is called a secondary source, and that is from whoever may have accompanied the patient to the office or hospital, the family members, the power of attorney, even the medical chart can be a source of secondary information. And so you want to make sure that you are designating which is which, okay? All right, so you want to, in this part of the exam, you want to find out why that person is here. So you ask them about their chief complaint or any symptoms they may have. You're going to gather a family history from them because many times that's going to give you information as to whether or not a particular illness runs in the family. You're going to ask about psychosocial factors, and those factors can include things like, do they exercise? How much sleep are they getting? Who's their caregiver? Do they smoke? Do they drink? Do they use drugs? Things like that. You want to know about their psychosocial health, and so you're going to ask questions related to that. Then next, you are going to talk about the actual illness or the complaint that they came in for. So that could be related to a particular system, or it could be related to pain. So let's talk about systems first. So that when I talk about that, I'm talking about neurological, respiratory, GI, any of those things. So you're going to ask them, what causes this? What happens before you actually feel this particular discomfort? Is this new? Is it old? Has it been treated before? What worked before in the past? What makes it worse? Does it radiate somewhere? Meaning that it goes to some other area of the body? Describe it. Have the person describe to you in their own words about the quality of the pain. And if they're having pain, then you can use pain scales. One is using the scale of numerically, the person says to you, rating their scale, rating their pain level. So from 0 to 10, 10 being the worst, how bad is the pain? They can tell you it's an 8 or 9 or whatever, and that'll give you the severity of it. You can also use Wong-Baker, which are these smiley faces that frequently we use with people who can't give a number to their pain. And you can look at them and you can kind of match what their face looks like with these smiley faces. Because if a person is grimacing, then usually that's a sign that they're in a lot of pain. We can also use visuals to evaluate whether or not that person's in pain or not. Because if they come to you and they're all bent over and they're looking like this and holding their area, you know that they are in pain. So speaking of pain, those are some ways that you can assess it. But these are things that you want to make sure that you know. You want to know the onset, like when did it begin, the location, the duration, how long does it last? Does it last an hour after you ate and then it goes away? Describe it, have the patient describe in their own words, anything that aggravates it, that makes it worse. Has it been treated before? and for them to give the severity of the pain. So it's really, really important that we get a good assessment of a person's pain in order to get it treated appropriately. Now, some of the other things that you want to know about your patient is maybe military history. Military history may give you a clue if a person, to have a discussion with the person, do they have any signs or symptoms of PTSD, which is post-traumatic stress disease. And that is appropriate and necessary because that person can't deal with loud noises or sudden noises and things like that. You want to know if they were exposed to any chemicals, because many times exposures to chemicals can lead to various types of cancers. You want to know any of the medications that they take, and this means prescribed medicines, herbal medications, over-the-counter medications, any vitamins. You want to know all of that. Tell them do not leave anything out. You want to know about their immunization history. You want to know about their family history. So you have them tell you about their family. Oh, my mom died of cancer. My dad died of this, because those things can also be quite important because we know certain diseases have an inheritance, are genetically inherited. Functional assessment. Are they able to do everything for themselves? Can they go to the grocery store? Can they still drive? Can they do any of those things? You want to be able to assess that from your patient. You want to do a cultural assessment. We talked about this last time. Find out if there's any cultural things that are important for this person. A spiritual assessment as well. And this becomes quite important because maybe that person wants their minister to come and see them or give them communion or things like that. So now we're moving into the various systems. So first, skin is the largest organ of your body. So you're going to assess that. You're going to look at their hair, their skin, their nails to see if they're dry or cracked or bluish in color, any indication that that person may not be getting adequate fluid intake. Then next we do what's called a HEENT exam, and that's head, eyes, ears, nose, and throat. And we're going to go over how we actually do that, but those are the 5 components of the HEENT. Then you can go into a sexual history or ask them questions. Of course, when the provider comes in, a physical assessment of any sexual organs can be assessed at that time. Cardiac, hematological, GI, urinary, GU, peripheral vascular, musculoskeletal, all of the systems, we want to assess those to see if a person has been having any problems with those. All right. And a mental health assessment. Mental health assessments could be to see if your person is alert and oriented. See if they can do a mini mental exam. See if they can remember things that if you tell them something, you ask them about it 2-3 minutes later, if they can recall that. So those are also important when you're doing a total assessment of a person. And documentation, if it's not documented, is not done. And so it's very, very important that you do that. Last but not least is a nutritional assessment, because this can also give you an indication as to what's going on with your patient. You want to know about recent weight loss or weight gain, especially if it wasn't planned. Malnutrition or obesity. You want to find out about that. And with obesity, with any weight issue, you want to look at height, weight, which gives you a BMI. BMI is a ratio that you get to determine the risk that a person could have to certain diseases. And so you should know those values. Like if you're under 18.5, then that's considered underweight. 18.5 to 24.9 is considered normal. 25 to 30 is considered overweight, and over 30 is considered obese. You should know those. All right. And then there's the diagnostic tests that will go along with the nutritional assessment, like your cholesterol, looking at your triglycerides, H&H, which is a complete blood count to look at your hemoglobin, hematocrit, your chemistries. All of those things would be necessary in order by the provider in order to get a clear idea of what is going on with your person nutritionally. So I hope that helps. I'll see you next time where we're going to continue on our path of learning things about health assessment. Please like and share. See you next video. Bye for now.